Hello everyone, today we are going to talk about the semiological signs for the diagnosis of acute appendicitis, case report, and literature review. It is important to know that this article was published in Crossref, that is a metadata search, and it's a primary user interface for metadata searching and filtering. People just have to enter any term they want to search and filter by multiple elements. So now we're going to talk about the authors, and one of them is Dr. Sirenio de Almeida Barbosa. He's a general surgeon, and he's currently working as a professor in the Department of Surgery at the Federal University of Ouro Preto. He is also a member of the Brazilian College of Surgeons, and until now he has written 6 works mostly related to hernias, whether inguinal, umbilical, or abdominal wall. Inflammation of the vestigial variform appendix is one of the main causes of acute abdomen in emergency departments. Clinical manifestations may vary according to the patient's age, position, and size of the appendix. The diagnosis is eminently clinical and may present laboratory and imaging alterations, contributing to the diagnostic confirmation. In view of the variety of clinical manifestations and differential diagnosis of the acute abdomen, the diagnosis can be challenging. But we have to consider that delayed recognition of this condition can lead to serious complications. So we have to be clear about the possible clinical laboratory and imaging findings. With that, the objective of this work was to present a clinical case and a review of the literature on the clinical findings in acute appendicitis, contributing to that early diagnosis. And to support the work, this article is current bibliographical references as PubMed, Cielo, and Lilacs databases.
Add to appendicitis is one of the most common surgical emergencies affecting mainly young people while of predominance of men. It is characterized by abdominal pain that migrates to right iliac fossa, accompanied by nausea. Its diagnosis can be complex and requires clinical evaluation, laboratory tests, and imaging. Laparoscopy appendicectomy is the most effective treatment, while further complications that open surgery. Appendicitis is classified by degrees of severity, and early diagnosis is key to avoiding complications.
Clinical case report. Patient SBL female leukodermy 72 years old, some medical assistant at the emergency room complaining of hyporexia, vomiting, and severe pain in the right iliac fossa for 2 days. She reported a previous colectomy due to complicated acute diverticulitis, hypertension, pain, using enalaprine 10 mg, atenolol 50 mg, and certainly 50 mg. The patient took only one pill for day. On physical examination, she was in an untouched position with a possibility McBurney sign, Ronsin sign, and iliopsoas sign. In laboratory tests, she showed an increase in leukocytes 15,419 UL, neutrophils 12,915 UL, CRP of 123.92 mg per liter, and blood glucose of 130 mg per deciliter. The computed tomography scan showed an enlarged cecal appendix measuring around 17 mm with two appendices inside, which measured around 10 mm and 6 mm, with significant densification of the adjacent part and a minimal around appearing appendiceal fluid, the patient underwent laparoscopic appendectomy. At the laparoscopy, and quick perforating appendicitis was visualized with loose fecality in the cavity and in addition peritonitis in the flat and pelvic region. After analyzing the inflammatory finding, it was classified as grade 4 appendicitis. Appendicectomy was performed by video laparoscopy and the material was sent to anatomy pathological examination. The pains record were without complication and they was discharged after 2 days of observation. The anatomy pathological result reviewed acute supracite appendicitis.
The text banks the staging tank inflammation of the brain-formed appendices is one of the most common causes of acute abdomen and requires immediate intervention. Factors that can cause appendicular obstruction include pest stones, infections, and beginning of malignant tumors. It is mentioned it is mentioned that in the young patients, the most common cause is lymphatic follicular hyperplasia due to infection, while in older patients it is usually due to fibrosis, hardened stools, or neoplasia. The classic clinical picture of appendicitis of characterized by initial abdominal pain in the periumbilical region, which migrates to the ring iliac fossa or wrist. Frequency accompanied by anorexia, nausea, and vomiting. There may also be changes in bowel habits and low-grade fever. Usual position of the appendices can lead to typical clinical pre- presentations and and at the extreme of age, simply may be milder complication for diagnostic. Okay, the text goes on to mention that on psychical examination, alteration may be found that contributed to the diagnostic. At characteristic finding is maximum pain at McBurney point. The Bruben sink indicate of irritation of the parietal peritoneum, and the sink, which implies pain in the rib with palpation of the left iliac fossa. Both indicate a peritoneal irritation are described. Finality, final, the paper discusses how the position of the appendix may influence symptoms. In cause, the appendices is retrorsal of pelvic. Passive hip station may cause pain due to its interaction with the psoas muscle or the internal obturator muscle respective, leading to lip psoas and obturator sinus.
Diagnosing acute appendicitis, there are several important clinical signs and diagnostic methods that can help guide healthcare professionals toward an accurate diagnosis. Today, we'll explore some key signs and techniques issues in identifying these conditions. One of these things is dumping sinks, where pain is elicited in the right iliac fossa.
when the patients cook indications irritation of the inflamed appendix. Another is Lander since, which shows an inflammatory process when the difference between axillary and rectal temperature is greater than 1C. It's also important to note the duration symptoms as there is direct relationships between how long symptoms have been present and the severity of the appendicitis. Early detection is crucial to prevent complications such as perforations. Laboratory tests can further assist in the diagnosis. In terms of imaging, CT scans are the most commonly used diagnostic tool for confirming appendicitis, except in case of children and pregnant women, where abdominal ultrasounds is preferred to avoid radiation exposure. The diagnosis of acquired appendicitis must be made early to avoid intestinal perforations, which is associated with great postoperative complications. The Association of Semiological Sciences. Symptoms and laboratory tests indicating inflammations already strongly indicate the diagnosis of appendicitis, and imaging tests should be performed to exclude possible differential. However, in the absence of alterations in the imaging exams, the clinic should provide signs in the initial stage. It may not present alterations. That it is important to have notice of the semiotic maneuvers that corroborate acute appendicitis.